Hey everybody, it's your favorite doctor here, Dr. Tiffany Butler, and welcome to my channel. And in this video, I'm going to be discussing pelvic pain, alright? So let's go over the anatomy. As always, I like to get you educated and informed on body parts so you know what I'm talking about and you can know what your doctors are talking about. Alright, so the pelvis consists of two bones, two types of bones, I would say. First is the sacrum. The sacrum is this flat base here. This is the back view of the pelvis. Alright, and this is the front view. I'll put a picture too. Alright, now the pelvis has the sacrum. Sacrum is sort of like a blade shaped. It is a result of five bones fusing together, alright, and that makes up the sacrum. And then we have the coccyx, right? So that's at the end. That is truly your tailbone, and that consists of four bones fusing together. Then you have your pelvic bones, which are called the iliums or ilii. The singular right here, as you can see, and this is the part of the pelvis that articulates or joins to make the hip. This is your femur. All right, now what are some of the causes of pelvic pain? As always, one of the causes can be trauma. All right, a trauma if you fall on your butt, car accident, it could be a sports injury. That would be considered what we call macrotrauma, which is very big trauma. Boom, you have pain. Then we have microtrauma. Microtrauma will be if you sit a lot. A lot of times when people have lower back pain, they may also have pelvic pain too. So I'm going to show you. So this area of the spine right here, this is L5, which is the fifth vertebra, the bottom, and S1, we call it sacrum 1, but the sacrum articulates with the lumbar spine. This is where your back takes a lot of pressure, right? So a lot of people have back pain, and this is right above the buttock, okay? Or you would call it like the belt line. People will have pain there. So if you're sitting a lot, this area of the spine gets a lot of pressure, all right? Because as you can see, the bone changes, the shape changes, all right? The spine changes. So microtrauma, fall, car accident, sports injury, and then micro trauma will be prolonged sitting, so your occupation can cause pain. Pathology, of course, degeneration. If you have things that's going on with the soft tissues and organs is inside of the pelvis, so let me show you. Alright, so inside of the pelvis, if you are a woman, alright, you have your ovary, you have your ovaries, you have your uterus. If you are human, you would have your bladder, all right? So the bladder will be here, the uterus will be on top. And if you're having pain or dysfunction with those organs, then you could have what we call referral pain, pain in the pelvic area or in the back area, all right? So that's could cause some soft tissue discomfort or disease. Some going on with soft tissue can cause pelvic pain. All right. The next is your occupation. I already said it before. If you're at a job where you're sitting a lot, if you're standing a lot, if you're driving a lot, the same thing that will cause your lower back pain can also cause you to have pelvic pain. All right, now abnormal posture. If you're a sloucher, yes, that's going to cause you to have pain in the pelvic area. If you are lifting, all right, so if you're lifting abnormally, if you're lifting improperly as well, if you're doing certain activities that would sort of cause the muscles to be overstretched and you have like a muscle strain, you can also have referral pain or pain in the pelvic area. A lot of times people have pain in the front of the hips, right here. Same thing, again, that will cause your lower back pain to hurt, can cause your pelvis to hurt because the way the muscles connect, right? The way the muscles travel across the hip. So this one I mentioned in my last video is called the iliopsoas muscle because it crosses over the hip joint. It connects, articulates with the lower back, and it connects to the femur, as you can see. So if you're sitting a lot, standing a lot, you can pull this muscle here, you can strain it, and it gets fatigued as well. You feel pain, and you have lower back pain as well as hip pain or pain in the pelvic area. You can also have pelvic pain if you have a hernia, right? A hernia is a result of part of tissue, so it would be like the intestines, sticking through a whole opening, all right, in the pelvic area, or even having a hernia in the abdominal, but in the pelvic area, and that's largely due to you straining, and that could be from straining because you're constipated and you're trying to move your bowels, or straining when you're lifting something heavy that could cause you to have a hernia as well. Now, how could I help you as a chiropractor if you have pelvic pain? Well, if the pelvic pain is a result of a musculoskeletal issue or muscle or skeletal or joint issue, then that's how I can help you, all right? If it's something that's more serious, I would say something like going on with your organs, such as your bladder, or if you're a woman, your uterus, then of course you need to go see a medical doctor for that, right? So they give you all the advanced testing, whether it's ultrasound, CT, just to see what's going on with the actual organs. However, if we rule that out and say, okay, doc, it's not the pelvis, it's not the uterus, it's not the bladder, but it's actually the muscles and joints. And hey, I can help you as a chiropractor. So of course, spinal adjustments. The goal of the adjustment is to place the body in the best position so they can heal naturally, all right? And that means realigning your spine. And that includes your pelvis, because your pelvis, particularly your sacrum, is a part of your spine, all right? And I'll give you an image and you'll see why. It's because it's all developing around the same time, so it's a part of your spine, all right? And so that's how I can help you. Spinal adjustments, as well as teaching you exercise. Exercise is very big. If you have weak pelvic muscles or weak pelvic floor muscles, a lot of times as a result of, you may experience incontinence, right? Meaning you cannot hold your urine, or difficulty stopping the urine once you start in the flow. So it could teach you exercises to help strengthen the pelvic floor muscles. Now, pelvic floor muscles will be right around here, okay? It's going to be at the bottom, right? Because if this will be where your front of your body would be, and all of the soft tissue and stuff will be right there, all right? So I can teach you exercises like that, exercises, spinal adjustments, and proper ergonomics. So when you're lifting, when you're sitting, and teach and train your body how to do that, all right? So the same way we would treat a lower back, be very similar how we treat your pelvic area, right? Because they're so close together and connected. So a lot of times I will adjust the patient's lower back as well as their pelvis, as well as their hips too. If the hips are not moving properly, I would cover the hip dysfunction in another video. All right, so that's all I have for you. That's how I can help you. What can you do at home? As always, if you do not get better within 5 days, okay, go seek professional help from a licensed chiropractor. And why do I say chiropractor? If it is a musculoskeletal issue, a muscle and skeletal or bone and joint issue, then your chiropractor can help you, all right? If it is something that's more serious or dealing with the internal organs, such as when I say internal organs, we talk about the soft tissue, such as the bladder and the uterus in the case of a woman, then of course, go see your medical doctor, because this is their area of expertise, all right? We can do home again. Stop eating medicine. If medicine is not helping after 5 days, then of course go seek a professional. If it's a musculoskeletal issue, go see your chiropractor. All right. You can ice the area. You can heat the area. However, you need to get movement into the area. If you do have scar tissue built up because of a result of an injury, a fall, the trauma like a fall, car accident, sports injury, or microtrauma, right? You're sitting abnormally for prolonged periods of time, such as slouching, or if you're at a job where you're sitting or standing, or you're driving for prolonged periods of time. Okay, this will cause you to have pain as well. All right, so hopefully you enjoyed the video. Hopefully I didn't talk too fast, and I'll give you some images just to get you a clear understanding. If you liked the video, hit like, feel free to comment and share if you did enjoy it. I am always open to talking about all things related to health, because I'm very passionate and love talking about health. This is what I'm here for, all right? And if you have any recommendations on any health topics, please put them down in the comment down below, and I will do my best to address them. All right, so that's all I have for you. Hopefully you have a great day. As always, remember that a healthy mind and healthy body creates a healthy life. Until next time, stay healthy.